feeding in pancreatitis. If you've got a patient with pancreatitis, should you feed them? Will.
I think so, yes.
And how do you do that? Why and how do you do that?
I would look to feed them due to the evidence that it's not going to impact on their recovery and recuperation by feeding them.
Yep.
And unless there was a need for an operation, it's not necessary to fast them necessarily.
And so if you feed them,
Yes.
what's likely to happen? So you give them
Yeah.
patient on the ward's got pancreatitis.
Yeah.
You give them a full diet.
Yeah.
Steak and chips, go nuts.
I think a graded diet would probably
Steak
be
and
useful because it's probably going to cause them pain if you gave them like a really fatty diet.
And why do you get pain?
Is it related to the release of pancreatic and hepatic like stimulation? So it's going to cause irritation to an already.
Yeah, look, I think you'll get irritation generally in the area. So the pancreas sits behind the stomach, and all that tissue is inflamed. So if the stomach's going to be peristalsing, that in itself would cause pain.
Sure.
Now, if they start vomiting after they have their steak and chips that you fed them, what would you do? True? To feed or not to feed in pancreatitis?
If they're vomiting,
Yeah.
then no, probably not.
What would you do, Georgina?
Consider putting them NG just to relieve that pressure and pain on the pancreas. Is consider, or you could put them on maybe a free fluid diet, something a bit more.
Gentle than steak and chips. Yeah. Ali? What's the definitive answer, Ali?
If there are some reason they vomited for feeding, IDS is common in pancreatitis. They might get severe pancreatitis.
What type of IDS?
What type?
Yeah.
Is it inflammation?
Look, historically, people were really scared about feeding people with pancreatitis. They thought if food was going past the ampulla, it would be irritating to the pancreas because food might go inside and irritate and already inflame the pancreas. But we know that's not true now. And it was studied, about 20 years ago. With this hypothesis, people tried putting in an NJ tube and then fed them through an NJ tube, and they tolerated that okay. And then people thought, oh, well, let's see if we can do an NG tube, and people just put an NG tube in. And so the thinking there is that if food going past the ampulla irritates the ampulla, having the tube here instead of here would cause problems. But people tolerated an NG tube just as good as an NJ tube. So why is that? We think, or my feeling is that the reason why you vomit is because you get an ILS, as well as kind of having potentially an ILS of the small bowel if you've got inflammation or maybe even a vascular issue secondary to the pancreatitis down here. You're going to get an element of gastroparesis in the stomach due to all the inflammation around it, and that's the main reason why they vomit and why they get pain. So why the NG and the NJ tubes work is because when you eat and drink, like you probably just demolish your coffee in 5 minutes. Okay, that's 250 mils in 5 minutes. How much do you get fed through an NJ or NG? What do the dietitians sort of wind up on their gadgets?
80 to 100 an hour.
Which is a meal and a half a minute, basically.
Yeah.
Right. So that's why that works. You're putting in a meal and a half a minute. And the stomach's got plenty of time to just sort of gently push that through. But if you're going to put 250 meals in 5 minutes, 50 meals a minute, as opposed to 1 meal a minute, that's when a stomach that's slightly stunned from the inflammation around here is going to go, oh, can't push this through, and it comes out through the top. So rather than saying, oh, well, the studies show, they tolerate an NG, instead of having an NG, that's why I tell patients, like, if you can drink 60 meals an hour, then you'll be fine. But if you drink too much, then you will vomit. And so that's why I sort of say, half a cup an hour. That's about 120 mils an hour, 2 or 3 meals a minute. And not all patients are going to listen. Some will be tempted just to guzzle it all down, but that's just But that's my thinking behind why you feed people with pancreatitis. There's no evidence that there's any damage caused by food going around there. And the reason why they get vomiting and pain is the inflammation around there. And that's it.